So these notes will go into your HBS comp book. These are notes on the different types of joints. There are 3 different types of joints, and notice I kind of divided it in half and talked about the first 2 on the top half, the third one on the bottom half, and we do have an insert that goes along with that. All right, so fibrous joints, cartilaginous joints, synovial joints. All right, fibrous joints are joints that essentially have no movement involved with them. They're where bones come together. They have fibrous tissue between those bones. And so some examples of fibrous joints are those sutures in the skull. So think back to that skull picture where you had those little wiggly lines that represented the sutures. Well, that's a fibrous joint. So that's where the 2 bones are coming together, but there's, especially once the bone calcifies, there's no movement there. The roots of our teeth, where it's connected to the jawbone, is another example of a fibrous joint. Some joints are cartilaginous. There is a little bit of movement with these joints. And instead of fibrous tissue, now we have cartilage between the bones. Some example of cartilaginous joints are the pubic symphysis and intervertebral discs. So in our vertebrae, those bones of the vertebra have cartilage that's between them, and that does allow for some movement. I mean, it's not super flexible, but you do have some movement in between them. Then finally, the joints that you're probably most familiar with are synovial joints. Synovial joints are freely movable. Synovial joints have articulating bone surfaces covered with cartilage, but are not directly connected with tissue or cartilage. Synovial joints have an oily, fluid-filled cavity between the bone. That oily fluid is the synovial fluid. So synovial joints are freely movable. They are articulating bone surfaces. That means that they are bone surfaces that articulate with one another. And those bone surfaces are covered with cartilage, but are not directly connected with tissue or cartilage. And synovial joints have an oily, fluid-filled cavity between the bones. So these are the 6 major kinds of synovial joints. Okay, so some of those terms, let's go ahead and define so they make more sense. Articulation is the action or manner in which bones or bone parts come together at a joint. Articulation is the action or manner in which bones or bone parts come together at a joint. Cartilage is a connective tissue that's helpful in reducing the friction in those areas of articulation. So cartilage reduces friction and helps to smooth surfaces. A ligament. A ligament attaches bone to bone. The purpose of a ligament is for stability. It attaches bone to bone and helps to hold bones in place. A ligament, the function of the ligament is to help with stability, to stabilize the bones. A ligament will attach a bone to a bone, so ligament goes from bone to bone, and ligament help to hold the bones in place. Tendons attach muscle to bone. So ligaments help with stability. Tendons allow for more movement because that's where the bone and muscle come together. And in order to have movement of the entire organism, we need both the skeletal system and the muscular system. So tendons help to allow for movement. Tendons attach a muscle to a bone. Synovial fluid helps to lubricate joints. Synovial fluid helps to lubricate joints. A condyle is a rounded end of the bone. This is the area where one bone articulates with another bone. That's just my own personal pronunciation guide. You can do whatever you want for that. You can look up and see what the actual one is. I just put my pronunciation guides how to help me pronounce. So condyle, rounded end of a bone, articulates with another bone. The tubercle or tuberosities, these are rounded prominences on a bone, so they kind of stick out on the bone. They're not the end of the bone, they're kind of sticking out. And this is where muscles or ligaments attach. So tubercle or tuberosities They're rounded prominences on a bone where muscles or ligaments attach. Trochanters. This is a specific type of tubercle that's on a femur. So basically it's the same thing, but on a femur they're called the trochanter. So this is a protuberance on a bone where muscles attach to the femur. Hyaline cartilage, and you can put it on a post-it if you want. I don't think I have anything underneath there. You can put it on a post-it or you can just define it in here. This was one thing that I realized I needed to come back and add. Hyaline cartilage. This is also known as articular cartilage. Articular cartilage, hyaline cartilage, those are the same things. They line the bones in the joint and create a smooth surface for movement. So hyaline cartilage, articular cartilage, that's the same thing. They line the bones within the joints and create a smooth surface for movement. And so just some other information, your Achilles tendon, that's connecting the calf muscle to your heel bone. That's a tendon that you're probably familiar with. The ACL, and that's what this picture up here has. So here's an example of a tendon because it's attaching muscle to the bone. So this is a tendon attaching that muscle to that bone. Here is a ligament attaching bone to bone. ACL, anterior cruciate ligament. That's this guy that's right here. So a lot of people like tear their ACL, damage their ACL. You might want to know what that is. That's a ligament that helps to stabilize your knee. It helps to prevent hyperextension of the knee and the movement of the tibia off the femur. ACL reconstruction surgery, it's a graft. Remove the damaged tendon and replace with tendon from a donor or from another part of the knee. And that's just FYI, that's just information right here, just because ACL is something that's common that you've known. You do need to know this. You need to know articular cartilage, hyaline cartilage. The rest of this is just kind of information to help you touch base and figure out what's going on. All right, continuing on, now we talk about range of motion. Some terms that are important with range of motion. This is continuing in our HBS course file. All right, so some terms associated with range of motion. Rotation is a circular motion in which a limb rotates on an axis. So rotation, circular motion in which a limb rotates on an axis. So that's like you shaking your head no. That's a circular motion. That's a rotation. Circumduction. Circumduction is a different kind of movement. It is a circular movement in which the limb traces out a circle. So that's like you stretch out your arm straight, point your finger, and then you draw a circle with your finger, and it's kind of a cone shape with that entire arm. So circumduction is a circular motion in which the limb traces out a circle. Flexion is a movement. Flexion is a movement that decreases the angle between the bones of a joint. So if you flex something, you are decreasing the angle between the bones of a joint. So if you hold your arm out with the palm up and you bend at the elbow until you touch your fingers on your shoulder, that's your flexion. That's flexing because that joint at the elbow is becoming a decreasing angle. Then, if you stretch that back out, then that's another movement. That's extension. Extension is a movement that increases the angle between the bones of the joint. Hyperextension. Hyper, once again, is more, is extra. So hyperextension is excessive joint movement in which the angle formed is beyond the normal or healthy range of motion. So hyperextension, you extend it. You have a movement that extends it past what is comfortable, what is normal, what's healthy. Abduction, if you're abducted, so you're taken away. So abduction is a movement that moves a limb away from the median of the body. Abduction, you move the limbs away from the median of the body. Adduction, when it's adduction, you're moving the limb toward the median of the body. So ADD, you add. So you're adding it, you're moving it toward the body. Abduction, you're moving it away. Plantar flexion. So plantar has to do with the sole of your foot. If you've ever had a plantar blister, plantar wart or something like that, that's on the sole of your foot. Plantar flexion is when you extend, is the extension of the ankle. So if you point your foot down, if you hold it relaxed and then point your toes down, that's plantar flexion. It's an extension of that ankle. Dorsiflexion, if we're talking about the dorsal sides, usually the back side, dorsal fin. So dorsal of the foot, that's the top of the foot. So that's the flexion of an ankle. You move your foot and try to point upwards. So you're trying to bring your toes towards your leg. Plantar flexion, you extend it, you're pointing down. Dorsiflexion, you flex the ankle, the foot is coming upward. Oh, let me do this real quick. All right, so this diagram right here. So you hold your arm out. That's showing flexion. That's showing extension. And then the dotted line shows the hyperextension. So you're moving it past what the normal comfortable range is. Abduction, moving away. Adduction, moving toward. And so you can do that with the, this is the hip joint, so we can do it with the leg as well. Abduction, move it away. Adduction, move it toward. Rotation, so if you're holding your hand at a 90-degree angle, and so you keep that 90-degree angle and you move it out, move it in, that's rotation, that's a circular motion. Circumduction, that's when you make a circular motion, make a circle, trace out a circle with that limb. And so when they trace that out, this is kind of like a cone shape there. All right, so the tool that a physical therapist might use in order to determine range of motion is the goniometer. So for our little goniometer, we have a stationary arm, we have a moving arm. The little brad, the little rivet in the middle is the fulcrum. Stationary means that's the spot that stays still. Moving, that's the part that moves as you move the joint. The fulcrum should be where the joint is. So fulcrum should be placed on the joint, and the moving arm of the goniometer follows the motion.